Hello, and thank you for choosing to listen to this webinar on successful management of feline idiopathic cystitis. My name's Sarah Caney, and I'm a UK-based specialist in feline medicine, and this slide just summarises a little bit about me and my background. I'd love for you to visit my website, vetprofessionals.com, where you can find a number of resources aimed at both the veterinary professional and also the pet owner. And this includes books that we have for sale. The relevant one for this webinar is Caring for a Cat with Lower Urinary Tract Disease, but as you can see here, there are a number of other titles. I also have a number of documents that are free to access via the website, and we perform research via online surveys on the website as well. And if you have helped at all to either do one of these surveys or recommend them to any of your colleagues or clients, then I would like to take this opportunity to thank you very much. But the topic for this webinar is one that is often something that causes a lot of headaches to us as clinicians. Feline idiopathic cystitis can be extremely frustrating to manage. And what I wanted to do in this webinar was really give you as many tips as I can on how we can make this diagnosis, what I can tell you about the background to this condition, the etiopathogenesis, and therefore what management strategies are likely to be most successful. Feline idiopathic cystitis won't come as a surprise to hear is a diagnosis of exclusion. Idiopathic cystitis means we don't fully understand the cause of this disease. So we do need to rule out other known causes of lower urinary tract disease, such as stones, urolithiasis, neoplasia, bacterial infections, and other possibilities. If you look in any textbook at the different types and causes of lower urinary tract disease, for young cats you'll see results similar to this slide. So idiopathic lower urinary tract disease, feline idiopathic cystitis, the main topic of this presentation, is estimated to account for more than half of cases cats with lower urinary tract signs. Urolithiasis thought to account for around 20% of cases, urethral plugs around 10% of cases. Infections, generally very low prevalence. Most textbooks will give you a figure of less than 2%. Having said that, in more recent literature, particularly from Scandinavian countries, a higher incidence of UTIs has often been reported. And so I think actually 2% may be falsely low. Perhaps it could be 10% or even 20% of cases that are seen in a primary first opinion setting. And there are a number of other possibilities listed at the bottom here. If we look at cats that have urethral obstruction, the so-called blocked cat, then the split is a little different, but idiopathic disease still really important as a cause of that. You can see here 40% of cases estimated to be associated with urethral obstruction. Again, stones and urethral plugs also important there. And lastly, if we look at the older cats, so cats over the age of 10 years, the split changes again. And this is a situation where actually the incidence of idiopathic disease really drops. So this becomes much less likely as a cause of your older cat's urinary tract signs. And as you can see on the slide, infections become much higher on your list. So 45% of cases accounted for by infection when considering that older cat. So a very, very different split. Feline idiopathic cystitis can present in a number of different ways. We can have cats that just have a single acute self-limiting episode and literally have one or perhaps only one or two during their lifetime. Those cats are not going to cause us too much heartache and not cause their owners too much heartache, but those that certainly do cause us a lot of issues are those that either have frequent recurrence of episodes, persistent clinical signs, and of course those that are affected by urethral obstruction, and that is an emergency and likely, much more likely in a male cat than a female cat. A lot has been done to try and understand what causes this condition, and whilst we still have a lot of unanswered questions, much of the research, particularly done at Ohio State University under the leadership of people like Professor Tony Buffington, has demonstrated that this is a complicated disease and that there is an interaction between the cat's environment and their ability to cope with stress, manifested by and regulated by the nervous system, the endocrine system, and the bladder. And that this is a condition for which a number of risk factors have been identified. Overweight cats that have a very sedentary lifestyle do have an increased vulnerability to it. Indoor-only cats that are using a litter tray and eating a dry diet, again, may be more vulnerable. You can see there are some slightly contradictory things though on this list as well, because we have both multi-cat households where stress between different cats can be an issue that's thought to exacerbate or predispose to this condition. But also we have single cats, perhaps indoor only, where perhaps environmental enrichment and other stresses may be present. Affected cats do tend to be neutered, and inter-cat conflict within the house and also between different households for those cats that go outside have also been cited as factors. And as I've already mentioned, stress is really more and more becoming something that we're aware is a factor, a very important factor in both triggering and exacerbating episodes of this condition. And Tony Buffington's group in recent years has published a number of papers referring to what they have called Pandora syndrome, which is a newly defined situation where we have a cat that has a defective stress response system, so a defective ability to cope with stress, and as a consequence of that may show a range of what they call sickness behaviours. And relevant to the lower urinary tract would be signs of cystitis, lower urinary tract signs, but these sickness behaviours can involve other organs, so hence we may have gastrointestinal signs such as loss of appetite or vomiting. We may have systemic signs such as fever, lethargy, altered grooming, and altered social interactions. And the suggestion when it comes to feline idiopathic cystitis is that these cats that have Pandora syndrome, really what you're seeing is the bladder's manifestation of a stress response disorder, that it affects them more generally. The criteria that have been suggested for diagnosis of Pandora syndrome are that firstly this is a chronic condition which either persists or recurs in association with different stresses, and that there is a comorbidity. In other words, other sickness behaviours are present in the cat that's affected by idiopathic cystitis. And ideally that you can demonstrate that clinical signs are associated with events that are stressful to the cat. So in other words, that the cat may be fine when everything is under control in its life, as it were, but if it is stressed by changes in the household, that could be enough to trigger these signs of idiopathic cystitis and other sickness behaviours. Many of these cats, it's hypothesised, have had a really difficult upbringing, so they may have had perhaps their mother may have had a difficult pregnancy, or the mother may have been a feral cat where resources were in short supply or life was very stressful. Early adverse experiences for the kittens as well, perhaps being hand-reared or bottle-fed, and there may be a genetic factors as well, because litter mates may also be affected and parents may be affected as well. So a number of criteria that we can look at to try and identify cats suffering from this so-called Pandora syndrome. And the suggestion is that these genetic factors and adverse experiences have an impact on the development of the cat's stress response system, and that it doesn't therefore develop normally, and these cats therefore are unable to cope in a normal healthy way with stress, but unfortunately manifest these sickness behaviours when they experience stress. So in a very simplistic way, we have a cat that for these various reasons is susceptible, its stress response system is not working adequately, and that cat may be absolutely fine if it's in a nice, calm, stress-free household. But if we add some stressful factors to that cat, so in this example we've added a child and a dog, that could be, for that individual, enough to trigger lower urinary tract signs and other signs associated with that stress. So very simplistic analogy, but hopefully illustrates the current hypothesis here. What sort of stress is important to cats? Well, they are control freaks. They like to be in control. So anything that takes them away from a sense that they are in control of their environment is likely to be stressful. The picture on the right here is of a cat at a vet clinic. This is an acutely stressful situation, and this cat is trying to pretend it's not here by closing its eyes. It's highly stressed. It's feigning sleep, but not because it feels confident and relaxed at the vet clinic. It's in fact feeling the opposite, very unhappy, wishes it was somewhere else. So things from an FIC perspective that are likely to be stressful, again, are things that take away the cat's sense of control, but likely to be more chronic stressful scenarios. And this slide just shows some examples, many of which I'm sure will be familiar to you, but you can also very much add to this list. But they would include new additions to the household, so a new cat or a baby or a dog, or new people in the household, changes in the routine of the homeowner, so perhaps someone who works shift or whose job changes, perhaps the builders moving in. All these sorts of things can have a negative impact, and if you're unfortunate enough to be a cat that's not very good at handling stress, then all of these things can precipitate signs of idiopathic cystitis. So going back to our clinical cases, when and how should we make a diagnosis of FIC? Well, making a diagnosis is particularly important in cats that have either persistent or recurrent clinical signs, and of course in those cats suffering from urethral obstruction. And the aim of our investigations is, of course, to identify whether there is a cause of the lower urinary tract disease that can benefit from specific treatment. For example, have we got urolithiasis? Have we got a bacterial urinary tract infection? And if not, if we rule out everything that we can, make a diagnosis of idiopathic disease and manage our patient accordingly. So the first step, of course, is going to be to take the history and establish whether or not this is a recurrent problem. Is the cat emptying the bladder? Is there any evidence of urethral obstruction? What clinical signs are present? What's been the pattern of disease, if appropriate, in the past? So that we can get as much information about this individual cat and help ourselves to make the best diagnosis as quickly as possible. One thing that can be difficult in some situations, certainly for owners, to differentiate between is whether a cat is spraying, which can be a normal behaviour, to scent mark, or whether it's suffering from inappropriate urination or indeed lower urinary tract disease. Spraying, of course, can be a completely healthy, normal behaviour, particularly for entire male cats, and typically involves vertical surfaces of the household, in contrast to inappropriate urination or periuria, which typically will involve horizontal surfaces, so surfaces like the bed, carpet or flooring in the house might be affected. And possible causes of periuria would include, of course, lower urinary tract disease, but also other options as well. So, for example, the cat with arthritis that is now finding it difficult to either get into a litter box or perhaps doesn't have a litter box and finds it difficult to use the cat flap, may start to urinate in the home. And similarly, an older cat, if it's suffering from kidney disease and is very polydipsic and polyuric, may just not be able to get to its normal toileting location in time, or perhaps is not, again, being offered a litter box to make life easy and therefore is starting to urinate in the house. So worth considering all of these possibilities when you're taking your history to understand what you're dealing with. A behavioural history is really helpful in more chronic cases of idiopathic cystitis because we know stress has a big impact on this condition. If we can understand more about that cat and more about its home environment, it can help us in terms of future preventative management. So we'll talk a lot about how we can assess the household for stress and how we can do this even if feline behaviour perhaps doesn't feel our strongest point. And of course, involving a behaviourist for those difficult cases can be really helpful. And so I will often, with those tricky cases, consider including a behavioural expert's advice and opinion in my management strategies as well. For multi-cat households, it can be really helpful to understand how many social groups there are in that household, particularly to ensure that there is an adequate number of resources available for those cats. And this is something that I think a lot of owners struggle to actually recognise how well their cats get on. But a useful exercise that Vicky Halls taught me was to ask the owners to write down the cats' names on a piece of paper. So you can see here we have Sooty, Twizzle and Hobie. And then when you see a cat showing positive behaviour to another cat, for example, grooming another cat or doing a nose-to-nose greeting with another cat, and I'll show you some more examples of this in just a second, you do an arrow, in this example in yellow, going from the cat that is initiating that behaviour to the cat that's receiving the behaviour. And you can see that in this diagram, Sooty and Twizzle are both behaving positively towards each other, showing this positive affiliative behaviour, whereas Hobie not only is not giving or receiving any affiliative behaviour, he's also showing overt aggression towards both Sooty and Twizzle. So in this example, Hobie, who was the newcomer, unfortunately is a bit Billy no mates. He is on his own. He is in his own social group, whereas Sooty and Twizzle are very happy to be in the same social group. So we have two social groups in this household, and we need to make sure that therefore we have enough resources for these groups and that there's no way that one cat could prevent another cat from accessing key resources like food, water, litter tray. So this is where some owners might find it difficult to understand how well their cats get on. And the top photo shows a household where you can see it really is a multi-cat household. And all of these cats are eating at the same time next to each other. And the owner of these cats would say to me, oh, look how well the cats get on, they all eat together. But in fact, this was the only way these cats would actually have an opportunity to have their food. If they didn't eat their food, very, very quickly, someone else was going to gobble it up. So the fact they're all eating next to each other is really out of necessity. And in fact, if you look at their body posture and their ear posture, they look quite tense. They don't look like they're relaxed and enjoying their meal. In contrast to the bottom photo, which shows two cats that absolutely look to adore each other, really wrapped up in each other, blissful expressions and posture. And the list on the left just shows some things that you might want to explain to an owner to look out for. So are your cats sharing food bowls, with the definite disclaimer about that top photo as an example of, that is not an example of positive affiliative behaviour, as we've already said. But do they groom each other, rub each other, chirrup to each other, play together, all these sorts of things. Signs of conflict, so those red lines, actually are often very subtle in cats. So again, this is the same household as the cats that you just saw all eating together. This is the same cats. And they're not fighting. There, in fact, was only the occasional hiss when I was ever present there. But you can see these cats, again, are not really behaving like they absolutely love each other. Quite a few of them seem to be facing in a different direction, so that perhaps they've only got one view in which perhaps they can only see one other cat, so they can pretend they're in a two-cat household or a no-cat household, it's just them. They're not wrapped up in each other, they're living very, very separate lives, and again their body posture is saying they are a little bit on alert for any problems to arise. Signs of overt aggression are uncommon, but certainly if an owner is aware of that, then that is highly significant. And this is a lovely video that I would refer you to look at, and also to suggest perhaps some of your clients refer to as well. It's one done by Cats Protection, the UK charity, and it goes through what to look for as an owner as signs that your cats get on. And importantly also then tells you what you can do in your house to make sure that if you have cats that are not best friends, that they can live as happy and calm and stress-free a life as possible in your company. So if you Google Cats Protection YouTube friend or foe, you'll be able to find this video resource. Provision of a litter tray is really important. Of course, it's essential for an indoor-only cat, but if you have even an indoor-outdoor cat that's had urinary problems, then access to a litter box is, I think, really vital for future quality of life. And we need to make sure that there are ideally one cat litter tray per cat and one extra. So again, we've make sure that there are plenty of trays in the house. If you've got an awful lot of cats, that's an awful lot of trays, but you definitely need to have at least one per social group, and one extra as an absolute minimum. And of course, stringent hygiene. These need to be inviting so that the cat is not deterred from using the tray because of poor hygiene. And from a hygiene perspective, a fine clumping litter is generally best tolerated. That's easy to keep clean because every time a cat pees, you can just scoop up that clumped litter once a week, completely empty the tray and clean it thoroughly. And also make sure that your litter trays are a nice generous size for your cat. Next, in our consult, we want to examine our cat and see if we can identify any abnormalities. Perhaps in our cat with urethral obstruction, we need to be careful about dehydration, signs that the cat is more systemically unwell. But in a cat with idiopathic cystitis, we do want to, of course, palpate the abdomen thoroughly, get a sense of whether the bladder is painful or thickened. And ideally, we also want a urine sample to analyse, because that gives us a lot of valuable information. I have a free download on the website that goes through the different urine collection techniques. So we have one for cystocentesis sample collection. We also have a free catch sample collection download as well. If you are catheterising the cat because it's been obstructed, then of course collecting a catheter sample may be appropriate. But last on the list, which you probably can't read because of the red lines, is expressing the bladder, which I would not recommend is done at all, particularly in an obstructed cat. There's a high risk of bladder rupture, but even in a healthy cat, I think this is definitely not cat friendly, not a good way to get your sample. Strictly speaking, for some of the tests we want to do, bacteriology being a key one, a cystocentesis sample would be preferred because that is an aseptic method of collection, and we're not having the urine contaminated by the urethra and the genital tract. But that's not always possible, particularly in a cat with low urinary tract signs that is urinating with an increased frequency and the bladder possibly not filling up very much. But certainly if we can, a cystocentesis sample is preferred. And we're going to look, of course, at the colour and clarity of that sample. Cats with a UTI may have a cloudy, turbid appearance to their sample. There may be evidence of hematuria. Assessment of the urine-specific gravity also relevant here, and most cats with idiopathic cystitis have extremely concentrated urine, so a USG well over 1050. Urine dipsticks are designed for human urine, and they are not very good at assessing our cat urine. So this slide is just a reminder of that in particular when it comes to looking for clues of urinary tract infection, do not be swayed in any way by the leukocyte pad on the dipstick, because in cats this is extremely unreliable. It pretty much always will have a positive colour reaction in cat urine, whether or not there is any increased number of white blood cells in their urine sample. So this is a reagent pad that I would ignore. pH assessment on dipsticks also is a little bit unreliable and can be affected by other things, as I've put on this slide. Dipstick's not very sensitive for protein assessment. If you are really interested in protein assessment, for example a cat with kidney disease, then you are far better doing a urine protein to creatinine ratio. Also bear in mind with your diabetic cats that your dipstick only detects one of the ketones. It doesn't detect the beta-hydroxybutyrate, so that is a drawback of the dipsticks. And there's relatively few things, in fact, as listed at the bottom, that dipsticks are actually acceptable for. So just remember that, be careful with your dipstick interpretation, and or choose dipsticks that have a fewer number of reagent pads so you don't have to worry about misleading results. Sediment examination is very helpful in these cases, and we can look for a number of things, including crystals and casts. Cats often have fat droplets in their urine, and this is a normal finding. So if you see small droplets in the urine, these shouldn't stain if you spin down your sample. That shouldn't be something that you see that confuses you with bacteria, but if you don't stain your sample, you may confuse yourself because they sometimes look a little bit wobbly under the heat of the microscope. And of course, people often worry about presence of crystals and how to interpret that. And the answer really to that question is that, in fact, having crystals in your urine is often completely normal and irrelevant finding in cats. And in particular, if your cat is fed a dry diet, it's highly likely to have struvite crystals in its urine sample, as you can see from the numbers here. And that's made even more likely if there's any delay at all in terms of analysis of that urine sample. So even a 10-minute delay in analysis of your urine sample can start to lead to crystals precipitating in vitro in your practice. And if, of course, the sample goes in the fridge or you don't analyse it till later on in that same day, you're going to get even more crystals precipitating. So you need to be careful with interpreting presence of crystals. Critically, the two things usually to look at are what are the type of the crystals that you can see. Struvite's very, very common. If you have a lot of oxalate crystals, then that potentially is a little more concerning. Can be present in some cats with hypercalcemia, for example. Urate crystals can be associated with liver disease, so the type of crystal certainly can have an impact on its likely significance, and also the number. So if you have a cat with urethral obstruction and you catheterize it and the urine is grossly gritty, you can really see sandy deposits in it because of the high number of crystals, then of course that is likely to be relevant to the cat. And also in formation of plugs, because cats that have urethral plugs, this is a matrix of protein with crystals embedded in it. So again, there is a relevance there. And for cats that have stones, then the crystal present in the urine might be the same as the stone. So you can sometimes guess what sort of stone you might have by looking at the type of crystal present in the cat's urine if it has urolithiasis. But of course, as you've detected in my voice, it's not absolutely fail-safe. There's not always a complete match, and sometimes stones have more than one type in them anyway, so that can also add to the confusion. But looking at crystals certainly does have some merit, but as I've said, it's mainly looking at what type of crystal you have and also the numbers, and try not to over interpret crystalluria, because it often is an absolutely incidental finding. As I said earlier on, bacterial cystitis is generally much less common in cats than the other causes of lower urinary tract disease, and less common in cats than in dogs. And this is probably because of some of the defences that the cat urine has. It tends to be very concentrated, so naturally resistant to bacterial colonisation. However, some recent studies, as I mentioned at the start, particularly in Norway and Scandinavia in general, have indicated that the prevalence of bacterial lower urinary tract infections may be a little bit higher than our textbooks would tend to indicate. So it is certainly something that you're likely to see in your clinics, and ideally, of course, we base our assessment and our treatment of these cases on doing a detailed urinalysis, including bacterial culture, and then we can do some antibiotic sensitivity testing as well. I would certainly encourage you to do bacteriology in your cats if you have persistent or recurrent lower urinary tract signs. In particular, also if the urine specific gravity is reduced, because that urine is I think more easily colonized, more likely to be positive for a bacterial infection. And in your older cats, because as we said at the beginning, bacterial UTIs are much higher up the list of causes of low urinary tract signs in cats over the age of 10, and especially in cats that have other underlying medical problems such as diabetes mellitus, chronic kidney disease or hypothyroidism. And the figures at the bottom of this slide are from a publication a few years ago that looked at prevalence of UTIs in these different groups of cats, and you can see it is quite significant. Some of these older cats will have clinically silent UTIs, so if you are just being very thorough and doing bacteriology on your older cat urine sample, you may identify some of these cases that actually don't have low urinary tract signs, and these are currently a little bit controversial in terms of how we manage them. If they are really, as far as we can tell, completely asymptomatic with that bacterial infection, then perhaps the best thing is to monitor rather than treat those cases. But some of those cases that don't have low urinary tract signs may still be impacted by that bacterial infection. For example, they may have a pyelonephritis or they may have systemic signs associated with that infection, and those cases of course are likely to benefit from antibiotic treatment. But it can be a little bit tricky and is definitely an area of current interest and controversy in the world of feline urology. Blood work is often not specifically helpful in diagnosis of idiopathic cystitis, but it is really highly recommended in those acute cases of urethral obstruction, where primarily we want to understand, well, how compromised is this patient? Am I going to be safe to sedate or anaesthetise this cat to relieve its urethral obstruction? What electrolyte, acid base, hydration abnormalities do I need to correct before I get to that point? And more of us have ability to image our patients quite nicely in the practice, and ultrasound of the bladder can be actually quite rewarding. It's one of the easier organs to get an image of, in that because urine is a fluid, it shows up black on an x-ray, and we can then look at the bladder wall and the bladder contents. And in some cases, like these examples here, we may be able to see very definite pathology, whether that's a stone or evidence of a growth within the bladder wall or thickening of the bladder wall. So ultrasound certainly can be helpful, although some cases it can be a little bit misleading, and in some cases it doesn't give us as many answers as we would like. And for example, some mild thickening of the bladder wall which is quite common in idiopathic cystitis, is not always easy to identify on ultrasound. Contrast radiography, probably less frequently done now because of more and more of us having ultrasound available to us, but can be helpful. And this is a retrograde contrast study in which we can see the bladder is not filling normally, and in this cat that was because of a tumour of the bladder wall in the anterior and dorsal portions of that bladder, hence that filling defect. So don't forget that radiography still can be actually very helpful diagnostically in these cases. Other cases, well, if you do have access to cystoscopy, then that can be helpful in terms of looking at the inner surface of the bladder and seeing evidence of inflammatory changes, hemorrhage. These images from Andy Sparks show the sort of pictures that you might see from a cat with idiopathic cystitis if you're to have these sort of facilities available to you. And of course, a bladder biopsy can be indicated in some cases, particularly thinking of those neoplasia cases, but also some refractory idiopathic cystitis cases, or can actually it can be worthwhile biopsying to rule out neoplasia and to definitively confirm what you're dealing with. In some cases, a mural infection with bacteria has also been reported. So some of these cases, doing a biopsy, sending some of that biopsy for bacteriology as well as looking at histologically, can be helpful. But many of the cases we see, we've reached a presumptive diagnosis before needing to add these tests. So this is for me certainly the minority of cases that I would be recommending a biopsy for. So let's move on to talk about management, and thinking of an episodic cat, certainly the acute management is something that is important, because this is a very distressing and debilitating condition, important for us as clinicians, I think, to feel that we're helping our patient, and also important for the owners, because it can be a very distressing condition for them to experience, or to see their cat experiencing. And then in the long term, of course, we want to prevent this situation from returning. The acute condition is certainly painful, so use of analgesics, I think, is appropriate. If you have any concerns whatsoever about renal function, and indeed in any case, opiates like buprenorphine can be very helpful, and the oral transmucosal route, which is what OTM stands for, is an easy way of administering this to the cat in the clinic and also at home. So for example, if you have a cat presented with these signs, you can actually administer some buprenorphine before you start your physical exam in this cat, so it actually perhaps is not going to be completely analgesed by the end of your consult, but by the time it goes home, it will at least be starting to feel a little bit better, which is nice for us to feel. Non-steroidal anti-inflammatories like meloxicam also can be helpful. Certainly some caution if you suspect that the cat is dehydrated at all, then I would avoid that. But if you think this cat is well hydrated and has good renal function, then that's an appropriate analgesia to consider as well. There are other medications that have been used in the acute scenario, so we have also antispasmodics, things like prazosin for those cats suffering from urethral spasm, and for some cats this is a recurrent problem, so actually we can then give the owner a supply of prazosin to have at home, and if they detect that the cat is perhaps going into an episode, then they can actually preemptively treat with prazosin at home and perhaps monitor the cat and avoid that very stressful vet visit. And more recently, people have been using meropitant, Cerenia, which is a substance P inhibitor, for its effect in the sort of acute, painful idiopathic cystitis, and some interest in that, so that's something else to consider. And then, of course, we have all the discussions about the home and the environment and the longer-term management prevention of this condition. And that's going to involve looking at the home environment and to hopefully identify and address sources of stress. We also want our patient to increase their water intake. There may be some dietary considerations to discuss, and potentially medications, pharmacological assistance. And in the long term, particularly considering that stress is often wrapped up in these cases, I really want to try and find a way of minimising future vet visits and hospitalisation for these patients. That's not to say that we don't want to be in contact with the owners, but perhaps be a little bit more flexible. So telephone consultations, or have the owner come in even without the cat for some of the checkups and discussions, rather than dragging the cat back that perhaps is then going to be very stressed and suffer from another episode. A term that was coined by Tony Buffington some years ago now was MIMO. This is multimodal environmental modification, and this is really the basis for our environmental management of cats suffering from idiopathic cystitis, and which is covered in some detail in my book Caring for a Cat with Lower Urinary Tract Disease, the cover of which is shown on this slide. And really this aims to be a programme that individualises patient management by explaining to the owner really what is a cat, what our cat's need, to understand how cats work, and then looking at that cat's environment and their home life to really make the changes that help improve that cat's well-being and sense of reassurance in the home, and sense of control, so that hopefully future episodes are minimised. And so some of the key features of this MIMO programme are certainly not to ever punish the cat for showing any inappropriate urination. Ideally increase water intake, as we'll talk about next. Make sure there are sufficient resources for the cats, so food, water and litter boxes. The sort of litter box recommendations we've already mentioned, but also additional environmental enrichment so that the cat has something to do if the owner's out at work all day. Also guidance on how the owner interacts with their cats. Some owners are quite demanding of their cats, and they want, when they come home, for the cat to sit on their lap or to be with them, interacting with them for the rest of the day. And some cats find that quite stressful. So trying to teach owners to really be there for the cat if it approaches them, but try to minimize them initiating contact with the cat. So let the cat do things in its own way, on its own terms. And of course, resolve multi-cat tension in the household as far as possible. And this MIMO plan is very successful, and the paper that Tony Buffington wrote up in 2006 related to some really severely affected cases, and in fact had a very high cure rate, as you can see from the yellow box here. Not all cats cured, but these were very severely affected cases, but certainly 70 to 75% cured is still, I think, fantastic. So we look at the cat's environment and provide guidance on that, ideally for the individual. This, of course, can be quite time consuming, but for those recurrent cases, really, it's time and money well spent. Also, try and tutor the owners to what to look out for. Often they will get very good at picking up on when their cat is developing an episode, and then you might be able to avert it with perhaps the prazosin if it is a cat vulnerable to urethral spasm, or just addressing environmental stresses and encouraging water intake for other cats. And look at the social resources, the number of social groups in the household, as we talked about earlier on. Really try and think as cat-friendly as possible, so tutor owners to where to put a litter box, somewhere quiet and calm, the ideal litter box hygiene regime, all these sorts of things. It's worth going through with the owners so that they are doing as much as they can. Really, this is a condition which totally rests in their hands in terms of the likely success. So a quiet, undisturbed location for that litter box, having a big enough litter box. So we've got a range of sizes in this bottom photo, picking one that is about 1.5 times the length of the cat from the nose to the base of the tail, so it's comfortable for them to turn around and scratch and pee, and avoiding covered trays, litter tray liners, perfumed litters, all these things that cats dislike. If the cat does urinate in an inappropriate location, then very quickly that can, in the cat's mind, be an appropriate location to return to. So it is important to clean it properly, to remove all scent and all of those proteins that are present in the urine that the cat can smell, and their very fine sense of smell can detect even when we can't, and that says, yep, I peed here before, therefore this is now a toilet I can return to. And this recipe here, again, is one that Vicky Halls shared with me a long time ago now, but using biological products to break down all those proteins in there and hopefully eliminate the presence of that urine signal from the cat completely. Ideally as well, from a future management, you should make that area inaccessible to the cat. So for example, if they urinated behind the television, and you can perhaps put a small table or chair where they went to prevent future access, as well as following this cleaning protocol, that can help. And of course, for very badly damaged areas like that photo on the right, you may find you just need to remove that carpet or replace that flooring completely. Feline pheromones can be very helpful in these cases as well, very much as an adjunctive treatment to environmental modification. So Feliway on its own is rarely able to cure a problem, particularly in a household where there is significant stress present, but in combination with modifying the environment, making sure there are enough resources for all of the cats, it can really help to support that. And the F3 facial pheromone is the Feliway Classic. This is the pheromone that cats rub when they rub their chins against you or against the wall, and it makes them feel reassured and safe. So it's a good general pheromone to have in your environment, also in the clinic environment as well, for us as vets. There is a spray available which you can also use on bedding. There is the alcohol base of the spray. You should give some time before you introduce the cat to let that dissipate, so don't use that in the same airspace as the cat, but you can use it before the cat appears, and leave the plug-in diffuser on all of the time. More recently, SIVA have launched a product called Feline Friends, which is the cat appeasement pheromone. This is produced in the mammary area during nursing of kittens, and is called a harmony marker. It reduces tension and conflict between cats living in the same area and sharing some resources. And this certainly I have found very helpful in some of my cases where there has been inter-cat conflict in the home, and it can be used on its own or in combination with the classic Feliway according to what you feel is appropriate for that situation. Next, we want to increase water intake. And the reason for this is probably multiple, actually. We do want our urine to be more dilute so that any noxious or irritant substances that might inflame that sore bladder are diluted out, so less noxious and irritating to the bladder lining. But we also want to encourage the cat to empty its bladder more frequently as well, so that these things are not in contact with the bladder lining for too long. And again, to prevent that overweight sedentary indoor cat from just perhaps peeing once or twice a day. We want it to go more frequently. There also is a suggestion that feeding a wet diet may be a form of environmental enrichment for cats. It's certainly a different owner experience feeding a wet food compared to a dry food. I think you tend to be much more involved with the cat when you're feeding it wet food. It's can be more rewarding experience from an owner perspective compared to just tipping some biscuits in a bowl and walking away. And from the cat's perspective, there is a different sensation. So there are a number of reasons why that suggests to perhaps have a positive impact on our cats. But the main reason really that we started to do this was because of a paper, actually quite a long time ago now, by Markwell and colleagues, which showed that the recurrence rate of idiopathic cystitis in one study, a diet study, was very much reduced by feeding the wet version of the diet compared to the dry version of the diet. And you can see the urine-specific gravity accordingly was lower in those on the wet food, and the recurrence rate was lower in the cats on the wet food, and that's really what started it off. And so this has remained one of the recommendations for management of these often challenging cases. So what can we do to increase water intake? Well, ideally a wet diet, but if you do have a dry food addict, then you can try adding water to their dry food. Some cats will eat dry food to which water has been added, but they won't eat the wet equivalent. So all these little tips and tricks can be helpful, and a number of things I've put on this slide, but also on my website, the free download encouraging your cat to take in more fluids goes through the sorts of things an owner can try at home to encourage this, that range from trying different sorts of bowls. Cats tend to prefer glass, ceramic or stainless steel to plastic, for example. Trying running water, and you can see there's some very inventive designs that exist for running water fountains these days that cats will like, as well as the dripping tap option. Flavoured water, all sorts of things that people can try that can make a difference. And from an owner perspective also, they can, I think, can get quite competitive about this, because we can of course monitor urine specific gravity as evidence of success in improving our cat's water intake, and owners can, in my experience, get quite quite competitive on, well, how low can I get my cat's urine specific gravity, and they can actually see the results of all of their hard work. I did mention some cats are dry food addicts, and if they are, then I think this is definitely makes more of an argument for using one of the specially designed urinary diets, so the therapeutic urinary diets that exist. And these are not identical, but they have overlapping similarities in terms of their design. So some of them have additional salt added to encourage drinking. Some of them have other modifications that are aimed at improving urinary health. And there have been some really good results in terms of dietary trials. So for example, a study published fairly recently in which standard Hill's CD was used compared to an artificially made diet designed to represent a typical supermarket diet, showed a dramatic reduction in the recurrence rate of idiopathic cystitis signs, the cats on the CD compared to this supermarket equivalent. And in fact, the the drop in recurrence rate was similar for the cats on the dry CD and on the wet CD. So the water content of the diet did not seem to be as important in this diet. So again, if you have a dry food addict, maybe that's something worth considering. Other dietary considerations, well, certainly during transition, offer the new food in a separate bowl. Consider some puzzle feeding or enriched feeding. This is another photo of Vicky Hall's where her cat is being offered dry food kibble in a toilet roll pyramid. So something that we can all do, although depending on the size of your household in humans, it might take some time to accumulate this number of toilet rolls. And this sort of environmental enrichment can really, I think, make a big difference, particularly to the indoor-only cat's quality of life. There are more recently diets available, again on a therapeutic front, that incorporate stress alleviating compounds, things like L-tryptophan and the milk hydrolysate alpha-casosapine. So diets like the Hills CD urinary stress and the Royal Canin calm diets. And there is some data to support the fact that these diets reduce anxiety in cats, reduce stress. A small case series from Hills, again with their stress diet, showed improvements in stress-related behaviours and idiopathic cystitis signs. So these sorts of diets, I think, do have a role in these cats with idiopathic cystitis, as well as having the sort of typical modifications for urinary health as outlined here. Beyond that, there are other things that you'll all be familiar with, for example, glycosaminoglycan supplements, which are contained within the therapeutic diets but also available separately as supplements. Unfortunately, published data looking at efficacy of these supplements has not overall been convincing, but it does seem that some individual cats do respond to them, but overall evidence for efficacy is quite weak. Similarly, there are some bigger gun drugs that have been used, tricyclic antidepressants, selective serotonin reuptake inhibitors, and some benefit in some studies, particularly amitriptyline longer term, not as an acute treatment for an acute episode, but perhaps for more of those persistent cases. So may have a role to play there, but I try to avoid moving on to these drugs. Really, I always feel a bit sad and disappointed in myself, really, if I need to use one of these big guns, because it's telling me really that this cat, in spite of the modifications to its home environment, is still feeling stressed and therefore needing more. And rehoming a cat, if it really is in that situation, is something that I would discuss with an owner. If really their household is never going to be as stress-free as would be ideal for that particular individual, then perhaps actually initially a trial rehoming with a friend or relative who has no other cats is worthwhile to test that theory out. And if the cat settles in and is happy and not showing signs of idiopathic cystitis, then perhaps remaining in that household is the kindest thing for it in the long term. So in summary, this is a very challenging condition to treat, and really it is one where the key outcome is going to really depend on the owner's involvement. And if the owner is keen to understand the condition and keen to help their cat and happy to work through all of that list of things that they need to consider in the household in terms of social groups and resources and multi-cat conflict, then they can get fabulous results with our support, hopefully, and with the support of things like the book Caring for a Cat with Lower Urinary Tract Disease. Stress management, really vital component, but also I do strongly believe that increasing water intake does make a big difference to these cases. So in spite of the fact that some studies more recent studies have not shown a big difference between the wet and the dry diet, this would still be something that I would really encourage your clients to do. And if nothing else, it really gets them bonded to their cat and how it's doing and involved in its care, which I think is of benefit. Some cats, of course, do need medications of varying description, as we've discussed, but many of the cats can be managed really with a combination of the environmental management, stress management, and water intake. Thank you very much again for choosing to listen to this webinar. I do hope that you found it helpful, and if you do have any specific questions, you're very welcome to email me through the contact page of the Vet Professionals website. Thank you very much.